Good, how are you?
Good. My name's Kylie and I'm going to be your student nurse. Are you in any pain today? No. I'm going to be doing a head, face, and neck and an eye exam on you. Is that okay?
Yeah.
Yeah, I'm going to ask you a couple of questions while I rubbing this hand sanitizer. What was the last time you had a bowel movement?
This morning.
This morning. How frequently do you have those?
Once a day, normally.
Once a day. When was the last time you urinated?
This morning.
How frequently do you do that a day?
Like 4 or 5 times normally.
4 or 5 times a day. Okay. Would you mind to tell me your name and date of birth?
Jamie Shaler, 9399.
Perfect. I'm going to ask you a couple of questions regarding the systems that we're going to be checking out. So, for eyes, have you had any blurriness in vision or change of vision lately? No. And for your head, face, and neck, do you have any dizziness or have you had to start using any walking aids or anything? No. Okay. General survey, patient is upright, she's alert, conversational, appears stated age, and a nice light pink in color. Now I'm going to begin the exam. So first I'm going to inspect and palpate your head. So I'm just going to feel around. Do you have any pain or tenderness?
Nope.
No? Okay. So there are no masses, there's no pain, there is no lesions present, and now I'm going to inspect your face. So there are 2 lesions in both ears, but they're just piercings. There's no involuntary movements. Your eyebrows and your nasolabial folds are symmetrical. Back to your head, it is normocephalic and round and symmetrical, but back to your face. Like I said, no involuntary movements. I'm going to feel for your pulses, your temporal pulses. So both are 2+ bilaterally. They are regular and equal. So now I'm going to feel on your face for your TMJ. It's just your joint right here. So if you'll open your mouth all the way and then close. Did you have any pain or tenderness with that? No? Okay, so there's no pain, no tenderness, and there was no deformities or limitations when opening and closing the TMJ. So now I'm going to inspect your neck. I'm just going to look around real quick. Okay, I'm going to start feeling. Do you have any pain or tenderness? No? Okay. There's no masses, there's no bumps, there was no lesions, and no pain or tenderness. Now I'm going to feel your lymph nodes. So the first one that I'm going to do is your occipital, so that's just back here on the base of your head. Any pain or tenderness? No. Okay, I'm going to do your preauricular. Any pain or tenderness? No. Postauricular. Any pain or tenderness? No. Okay, now I'm going to do your submandibular. Any pain or tenderness? No. Okay, your submental. Any pain or tenderness? No. Now I'm going to do your posterior cervical chain. Any pain or tenderness? No. Okay, I'm going to do your deep cervical chain. Any pain or tenderness? No. And then I'm going to do your superficial cervical chain, which is just right here. Any pain or tenderness? Now I'm going to do your supraclavicular. Okay, any pain or tenderness? Okay, so throughout that, no nodes were palpable, which is good. Do you have any questions about your head, face, and neck exam? No? Now I'm going to start your eye exam. So the first thing that I would have you do is the Snellen eye chart, but we don't have that. But I would have you stand 20 feet away from the chart, and you would keep your corrective lenses on. The first thing you would do is cover one eye and read as low as you can. Then you would cover the other eye and go as low as you can. And then you would uncover both and read. I would figure out what you got. If it was any worse than a 20/30, I would have to refer you to a specialist. But right now I'm going to have you do the NUR vision test. So if you don't mind, would you read number 5 for me, about 14 inches away?
Inspect and palpate the neck.
Perfect. So you passed the NUR vision test because you were able to read 14-point font 14 inches away from your face without moving it any extra. Now I'm going to do the confrontation test, so I'm just going to get a little up close and personal. So what you're going to do is cover one eye for me, either one, okay? So you just let me know when you can see my fingers wiggle, okay?
Right now. Right now. And now.
Okay, so now I'm going to mirror you, and I'm going to wiggle my fingers again and bring it in. You just let me know when you can see it.
Right now. Right now.
Okay.
And right now.
Okay, great. we're gonna do it with the other eye now. So if you'll cover your other eye for me. If you'll just let me know when you see my fingers wiggle.
Right now. Right now. And right now.
Okay, so I'm gonna mirror you again, and you let me know when you can see my fingers come in.
Right now. Right now. And right now.
Perfect. So you passed the confrontation test, which means your peripheral fields are intact because you were able to see my fingers at the same time or before I could. Now I'm going to do your EOM, which is just making sure that your eye muscles work properly. So if you just follow my finger with just your head, or just your eyes only, leave your head still. Good, now this finger. Okay, so you passed the EOM because you were able to follow my finger without any extra eye movements. Now I'm just going to take a look at all your structures. So on the outside, your eyebrows are symmetrical with one another. They're present, they're full, your eyelashes are full, you don't have any missing. If you'll close your eyes for me, I'm just going to look at your eyelids. Okay, you can open. So your eyelids are light pink in color, they're symmetrical, and I'm going to look at your conjunctiva. So if you'll look up for me. Perfect, it's a light pink in color, and your sclera is white. Now I'm going to look at your inside eye features. So first I'm going to look at your cornea. So if you just look straight ahead for me. Okay, so I'm going to look at this side. So both your corneas are clear, which is what we want. Your irises they're hazel in both eyes, the color's evenly distributed. Your pupils are round, they're equal in size. Typically I would measure them, but I don't have a tool to measure them right now, but they are black. Now I'm going to check your light reflex and your accommodation. So this is just all to do with your pupils. So the first thing I'm going to do is shine this light in your eye twice, and you just look at me, okay? Direct. Consensual. I'm going to do it on your other eye. Direct. Consensual. Perfect. So you passed the light reflex because your pupils were direct and consensual when constricting. So now if you'll follow this pen light, okay? Okay, I'm going to do it one more time. Perfect. So your eyes, they constricted and converged, which means you passed the accommodation test. Do you have any other questions for me? No? Okay, so that completes my exam. If you do, my name is Kylie again, and I will be back in 30 minutes to an hour.
Thank you, Nurse Kylie.